Bismillahirrahmanirrahim. Assalamu alaikum. I am Rabia Noreen. I am a clinical psychologist. I will discuss about personality disorder here today. So first of all, let me tell you some explanation about personality. As you know, each of us has a personality, a unique and enduring pattern of inner experience and outward behavior. We tend to react in our own predictable and consistent. These consistencies, often called personality traits, may be the result of inherited characteristics, learned responses, or a combination of the both. Our personalities are also flexible. We learn from experience, we interact with surroundings, we try out various responses to see which are more effective. So, what is a personality disorder? A personality disorder is an inflexible pattern of inner experience and outward behavior. The pattern is seen is most of the person's interaction continuous for years and differs markedly from the experiences and behavior usually expected of people. The rigid traits of people with personality disorders often lead to psychological pain for the individual and social or occupational difficulties. The disorders may also bring pain to others. Personality disorders typically become recognizable in adolescence or early childhood. This is the most difficult psychological disorder to treat. Many sufferers not even aware of their personality problems and fail to trace their difficulties. DSM identifies 10 personality disorders and separate them into clusters and three clusters: odd personality disorder, dramatic personality disorder, and anxious personality disorder. First cluster is the odd personality disorder, consists of paranoid, schizoid, and schizotypal personality disorder. Second cluster, dramatic personality disorder, consists of antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Third cluster is a anxious personality disorder, consists of avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. So, let me explain the first cluster, odd personality disorder. Odd are eccentric personality disorder. People with these disorders, paranoid, schizoid, and schizotypal, typically display odd or eccentric behaviors that are similar to but not as extensive as those seen in schizophrenia, including extreme suspiciousness, social withdrawal, and ways of thinking and perceiving things. Such behaviors often leave the person isolated. So, some clinicians believe that these personality disorders are actually related to schizophrenia and they call them schizophrenia spectrum disorder. People with these personality disorders often qualify for an additional diagnosis of schizophrenia or have close relatives with schizophrenia. Clinicians have learned much about the symptoms of the odd personality disorders but have not been so successful in determining their causes or how to treat them. In fact, People with these disorder rarely seek treatment. So, first subtype of first cluster, paranoid personality disorder. People with paranoid personality disorder deeply distrust other people and are suspicious of their motives because they believe that everyone intends them harm and their trust in their own ideas and abilities. People with this disorder are critical of weakness and fault in others, particularly at work. They are unable to recognize their own mistakes. However, they are extremely sensitive to criticism. They often blame others for the things that go wrong in their lives, and they repeatedly bear grudges. And this disorder apparently more men than women. People with paranoid personality disorder do not typically see themselves as needing people, as needing help, and few come to treatment willingly. Some peoples, you can see, and the psychodynamic therapist try to see past the patient's anger and work on what they view as his or her deep wish for a satisfying relationship. And other side self therapists and cognitive and behavior therapist, and on the cognitive side therapists guide the client to develop more realistic interpretations of other people's words and action, and to become more aware of other people's point of view. And the and on the behavioral side, the therapist help the individual to master anxiety reduction techniques and to improve their skills at solving interpersonal problems. So, second subtype of odd personality disorder, schizoid personality disorder. People with schizoid personality disorder persistently avoid and are removed from social relationships and demonstrate little in the way of emotion. People with paranoid personality disorder, these individuals do not have close ties with other people. The reason they avoid social contact, they are genuinely prefer to be alone. In short, schizoid personality disorder is persistent avoidance of social relationship and little expression of emotions. And the treatments of schizoid personality disorder, cognitive behavioral therapist to help people with this disorder experience more positive emotions and more satisfying social interactions. Now, on the cognitive side, they use their techniques include presenting clients with list of emotions to think about, or having them write down and remember pleasurable experiences. And the behavioral side, therapists have sometimes had success teaching social skills to such client using role playing, exposure therapy, exposure techniques, and homework assignments as tool. Group therapy also helpful in this disorder. Third subtype, schizotypal personality disorder. People with schizotypal personality disorder display a range of interpersonal problems by extreme discomfort in close relationship, very odd pattern of thinking and perceiving, anxious around others. They seek isolation and have few close friends. Many feel intensely lonely. The disorder is more severe than the paranoid and schizoid personality disorder. Treatments for schizotypal personality disorder. Therapy is very difficult in this disorder. as it is in the case of paranoid and schizoid personality disorder. Most therapists agree on the need to help these clients reconnect with the social interact, reconnect with the world, and recognize the limits of their thinking and their powers. Other therapy goals are to increase positive social contacts and reduce overstimulation and help the individuals become more aware of their personal feelings. And the cognitive behavioral therapy is also helpful for this disorder, because cognitive and behavioral techniques to help people with schizotypal personality disorder. Cognitive intervention try to each client evaluate their unusual thoughts or perceptions and to ignore the inappropriate ones. And therapists may keep track of clients' odd or magical predictions. Let me explain the second cluster, dramatic personality disorder. The behaviors of people with these problems are so dramatic, emotional, or erratic that is almost impossible for them to have relationships that are truly giving and satisfying. These personality disorders are more commonly diagnosed than the others. However, only the antisocial and borderline personality disorder have received much studying because they create so many problems for other peoples. First subtype of dramatic personality disorder is antisocial personality disorder. Antisocial personality disorder, described as psychopaths or sociopaths. People with antisocial personality disorder, persistently diagnosed, um, violate others' right. This is the disorder most closely linked to adult criminal behavior. A person must be at least 18 years of age to receive this diagnosis. Most people with antisocial personality disorder displayed some pattern of misbehavior before they were 15, including truancy, running away, and cruelty to animals or peoples, and destroying the property. No known treatment is not terribly effective. Second subtype is a borderline personality disorder. People with borderline personality disorder display a pattern of instability in interpersonal relationships and self image and mood, along with extreme impulsivity. Its treatment apparently can be helpful and lead to some improvements. And the third number is subtype is histrionic personality disorder. Histrionic personality disorder, once called hysterical personality disorder. Also, people with the histrionic personality disorder display a pattern of extreme emotionality and attention seeking. In the histrionic personality disorder, clinical case report suggests that the treatment is helpful on the early stage, on the spot. And the fourth subtype of dramatic personality disorder is narcissistic personality disorder. Finally, people with narcissistic personality disorder display a pattern of grandiosity, need for admiration, and lack of empathy. It is one of the most difficult disorder to treat. Now, third cluster is anxious personality disorder. People with these disorders typically display anxious and fearful behavior. Although many of the symptoms of these disorders are similar to the anxiety and depressive disorder. First subtype is anxious personality disorder is avoidant personality disorder. People with avoidant personality disorder are very uncomfortable and inhibited in social situations and extremely sensitive to negative evaluation. They are so fearful of being rejected that they give no one an opportunity to reject them or maybe the accept them either. People with avoidant personality disorder come to the therapy in the hope of finding acceptance and affection. Cognitive therapists help them change their distressing beliefs and improve their self image, and the behavioral therapist provide the social skill trainings and as well as exposure treatments. Second is a dependent personality disorder. People with dependent personality disorder have a pervasive, excessive, and need to be a care. As a result, they are clinging and obedient, fearing separation, their parent, their spouse, or other persons with whom they are in a close relationship. They rely on others so much that they cannot make the smallest decision for themselves. Therapy is to help a patient accept responsibility for themselves. Some clinicians propose couple or family therapy as well, or even separate therapy for the partner or parents. Cognitive and behavioral therapy interventions to help the clients on the behavioral, and the therapist provide assertiveness and training to help the individuals better express their own wishes in relationship. And on the cognitive and the therapist also try to help the client challenge and change their assumptions of incompetence and helplessness. So third and last is obsessive compulsive disorder, personality disorder, sorry. People with obsessive compulsive personality disorder are so preoccupied with order of perfection and control that they lose all flexibility, openness, and efficiency. Their concern for doing everything right impairs their productivity. So, in the treatment for obsessive compulsive personality disorder, and the people with this disorder do not usually believe that there is anything wrong with them. They therefore are not likely to seek the treatment unless they are also suffering from another disorder. Most frequently, an anxiety, depression, or unless someone close to them insists that they get treatment. Individuals with the obsessive compulsive personality disorder often respond well to psychodynamic or cognitive therapy. Psychodynamic therapists typically try to help them recognize, experience, and accept their underlying feelings and insecurities, and take risk and accept their personal limitations. And the cognitive therapists focus on helping the clients to change their dichotomous all or nothing thinking, perfectionism, indecisiveness, and chronic worrying. Finally, a number of clinicians report that the people with the obsessive compulsive personality disorder, like those with the obsessive compulsive anxiety disorder, respond well to SSRI, the serotonin enhancing antidepressant drugs. Anyways, a variety of treatment strategies have been used for people with these disorders and apparently have been modestly to moderately helpful. All topics discussed. So, Allah Hafiz.